A new study finds that a person's risk of developing type 1 diabetes rises more than 50% after a COVID-19 infection. Here to talk about that is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
50%, that number gets your attention. So, Dr. T, you've told us many times that diabetes, you've put it this way, diabetes is a risk factor for developing severe COVID, but why would COVID be a risk factor for developing diabetes?
Well, we don't know, Eddie, and that's one of the mysteries. And one thing I want to point out about this study is it was an observational study. So the fact is there was a correlation between COVID and diabetes, but that's not confirmed. Although one possibility could be that ongoing inflammation after COVID could somehow lead to insulin resistance, that somehow could lead to diabetes. One thing I do want to say, Maria, you had mentioned type 1 diabetes only, but this study really did look at diabetes in general.
I actually wondered that. I actually wondered that because I have a lot of people in my family with diabetes. So there are some people, including the researchers themselves, who think that this connection may be a coincidence. Why?
You know, that's right, because again, you know, infections don't usually lead to diabetes. Now, there are examples, there's precedents for this. HIV, for example, there is an increased risk of diabetes, but that's obviously a little bit different. That's a more chronic type infection, whereas we think of COVID as more acute, although of course we know that in some patients you can have that long tail. So that does remain a mystery. And I think that's what we have to try to figure out. Remember, we do know what some risk factors are for diabetes, like obesity. So one of the things we'd want to know about this study was in the patients that got COVID, did they have a significant weight gain, for example? There were other factors that are also risk factors like age and sex that in this study didn't seem to play a role. You know, so more to learn about this.
Dr. T, researchers started collecting this data in March of 2020. Obviously, the pandemic really mushroomed at that point. The virus has changed a lot since then. Right. So what's been the impact on the risk for diabetes?
Interestingly, the risk has persisted even into the Omicron era, which is really 2022. You know, some might say the virus has gotten weaker over time. You know, as we have developed more of an immune wall. But in this study, that risk of diabetes persisted up to at least June of 2022. That's the Omicron era.
Doctor, do you see any evidence that vaccines offer some protection against diabetes? And by vaccines, I mean COVID vaccines.
Well, I'm really glad you asked that. And I think that's an important part of this study is that those that were vaccinated and got COVID did not have a significant increased risk of diabetes. So it was really the unvaccinated patients that developed COVID that had this increased risk. And so one of the factors again is that is the vaccine being protective, meaning you have decreased inflammation and that potentially is preventing your risk of developing diabetes? Or is it that it's not really about COVID leading to diabetes, but perhaps the patients in the study that are vaccinated are in some ways healthier than those that are unvaccinated. One example would be maybe the people who are unvaccinated gained more weight in this study, and that was a confounder that led to diabetes. So more questions than answers. I don't want people to leave here thinking if you get COVID, you're likely to get diabetes, but it could be a risk factor. More to come.
Dr. T, indeed, but thank you for sharing your thoughts. It's always great to see you.
You too.
Thanks, Doctor. Be well.